The person living with dementia may not remember the day, but they can enjoy the moment. I'd like to acknowledge the traditional owners of the land on which we meet today and pay my respects to the elders, past, present and emerging. Thank you. Hello, my name is Sally. I've worked with people living with dementia and their carers for over 25 years, and I'm passionate about working with the community for better outcomes and helping to spread knowledge about dementia and how to live well with it and how to care for somebody living with dementia. This is my colleague.
My name is Valerie and I live and I work in this community. So I've had personal experience caring for a family member with dementia, and I'd like to learn more about dementia and how we can assist the community as well. So last night, Sally, I was talking to my cousin and we were talking about dementia, and she said, what's the difference between dementia and Alzheimer's?
Great question. It's the one I get asked more than anything else, would you believe? The easiest way to think about it is think of an open umbrella. Mm-hmm. The whole umbrella is a cluster of symptoms and diseases that make up dementia. So it's an overarching term, they say, for a whole lot of different diseases. And each little spoke that comes off the umbrella is a different kind of dementia. So the most common one that we've all heard of is Alzheimer's disease. The next most common is vascular, so that involves your blood vessels and maybe little strokes or clots, things like that can contribute to that. Then you have a mixture of the two, which I think is particularly unfair. There's ones that are associated with other diseases like Huntington's, multiple sclerosis, Parkinson's. Now, if you have Parkinson's or multiple sclerosis, it does not mean you'll definitely get a dementia, but there's a possibility, and there are relationships between them. Mm-hmm. You'll also hear people talking about early onset, younger onset. In the Aboriginal community, younger onset dementia usually applies for people 50 to 55 age group. Mm-hmm. In the non-Indigenous population, it would be over 65. And that's more unusual than the other types of dementia, and can progress sometimes a little bit more rapidly, not always by any manner of means. So there's a whole load, there's over 100 different types of dementia. A lot of people would equate it with cancer. You have, your umbrella would be cancer, and then every spoke would be a different kind of cancer. It's the same with dementia. Dementia is the overarching name, and then every spoke of the umbrella is a different kind of dementia.
Yeah, I like that. So they would have the same symptoms?
So no, they don't all have memory issues. Mm-hmm. Some people it's more processing and how to do things. Mm-hmm. But they can still remember everyday things quite well. Every single dementia has its own set of different issues. Some people it's memory, and I often get people saying to me, no, they can't possibly have a dementia because they can remember right back to when they were little children. Well, it's the short-term memory that becomes the problem, and then it will regress and go backwards. So often people with a dementia will have more memories or think back to more when they were maybe in their 20s, 30s, might forget they were married, might forget they have children. But you can't say that any two people are the same, because there's not. Nobody's written a script and that's what everybody follows. But each is affecting different parts of the brain, and that's what the testing can help show up and what the doctors pinpoint. Okay. And that's what leads to a diagnosis of which particular type of dementia they may have. And some people are just worried well, and they don't have it. They think they might have something wrong, but they don't. Yeah. And that's when the doctors will then keep an eye on them just to make sure that something doesn't develop later on.
So how would I reduce the risk of getting dementia?
There are a few things. You can't totally say you won't get it, but you can reduce your risk of getting it and maybe delay the onset. Mm-hmm. One of them is looking after your physical health, so exercise, mm-hmm. making sure you have your doctor's checkups.
Yes.
Take your medication as prescribed, which so many people don't do. Look after your hearing. Deafness is actually one of the contributing factors.
Oh, okay.
So wear your hearing aids. I have mine in today. It's important to wear them so you're actually engaging and contributing and hearing the conversations. Reduce smoking, mm-hmm. preferably not at all. Moderate with your alcohol. Avoid illegal drugs because they don't help at all. Exercise with walking, riding your bicycle. People can go to exercise classes, often through your local Aboriginal health unit, or within the community. Service providers would point you in your local direction. A lot of people do things like park runs if they have them in their area, or go to the gym. Just any form of exercise is better than nothing. Loneliness is a big contributing factor. So having a social life, an active social life, where you're seeing people. So even if it's the only thing you do is go to the elders group, that's fabulous because you're talking, you're having conversation, you're with people you're comfortable with.
Yes.
All those sorts of things are really good value to think about. So there are things you can do.
And food as well?
Food, very much. I would suggest, if you're worried about what foods, mm-hmm. ask your GP for a referral to a dietitian.
Yep.
Because they can really help work out what's better in your diet. Mm-hmm. Obviously, fruit and vegetables, and reducing the fatty food and the fried food, things like that will always, not too much chocolate.
Yes.
But and choosing certain fruits. So a dietitian would be a very useful source of information for that.
And crosswords?
Crosswords and puzzles are really good. What you don't want to do is just do the same thing all the time. Mm-hmm. Try and amp it up. So if you've never tried find a word, do find a words. If you've never done a crossword, try a crossword. There's all sorts of puzzle books with mixed puzzles in them.
Yeah.
If you're someone who uses your iPad a lot, there's plenty of free games and puzzles in there to help stimulate your mind. It's the art of learning something new. So if you don't know your traditional language, maybe try and learn a few words in your traditional language. You know, I know where we live, there's a bit of a resurgence in that area, so that's something that would be fantastic to do.
Yeah.
And share with grandchildren and children and things. It's that tricking your brain to do things differently. And I'll tell you one that's a really oldie but a goodie. I'm left-handed and I broke my left arm. So I had to brush my teeth with my right hand. Well, that was the weirdest thing I've ever had to do in my life. So one of the things they say is to regularly try and brush your teeth with the wrong hand. Now, when I brush my teeth, my hand goes all over the place. When I do it with the wrong hand, that action is bizarre. It feels weird. So I regularly, several times a week, brush my teeth with the wrong hand because it's teaching my brain something new.
Yep.
And it's something very simple.
That's a great idea.
You know, if you always cut with your right hand, try it with the other hand. It's not all as easy as it looks. There's all sorts of things like that that you can trick your mind into doing something differently. If you only ever read this kind of magazine or that kind of book, try something totally different.